Large populations of our microbes are more likely to have drug-resistant cells included because of transfer of plasmids or prior mutations. So if exposed, the sensitive cells are inhibited or destroyed, while the resistant cells survive and proliferate. So eventually the whole population becomes resistant, which is natural selection. And you can see here in this graphic, you've got the black ones are the non-drug resistant cells, and the little peach colored ones are drug resistant. And so we give the drug, and then you see the black ones are dying, but those peach colored ones are multiplying and dividing and making more, and so we give more of the drug, and eventually we killed off almost all of the ones that were not resistant, and we have a new population of those that are resistant. Ways that physicians try to limit drug resistance of these microorganisms is by making an accurate diagnosis and prescribing the correct drug therapy. The patient should take the correct dosage for the correct amount of time, just as the doctor's instructions say, and this will help to diminish these mutants that can resist the low drug levels and can help us to eliminate this pathogen. Sometimes physicians will also combine 2 or more drugs together to increase the effectiveness of at least one of the drugs, so that that strain that's resistant to the drug can be eliminated by the other drug. Also use drug research because it focuses on developing shorter term, higher dose antimicrobials that are more effective, that cost less, and have fewer side effects. And of course our pharmaceutical companies are working on this as well. The long-term strategies is to try to reduce the abuse of antibiotics. A long time ago, doctors prescribed antibiotics without doing cultures for strep throat. And a lot of times a sore throat is not strep throat. This is good because we only need to use these antibiotics for 1 or 2 types of infections. Also, we are reducing the use of antimicrobials to animal food. So governments need to make sure they give the low-income populations more effective therapy, and vaccines, of course, help to prevent problems in the future and give more protection. Now, sometimes the drugs and the host interact. About 5% of people that take antimicrobials can have a side effect or an adverse reaction to the drug. And usually the side effects are the toxicity of the drug damages the host tissues, or allergic reactions, or sometimes it disrupts the normal flora that's in our large intestines. And so we get these super infections sometimes. You've all taken antibiotics and had stomach upset, or know someone that has. That's because it disrupts the natural flora that's in your large intestine. So in selecting an antimicrobial drug, we need to consider 3 things. First, the nature of the microorganism that's causing the infection, and you can do this with cultures. Second, the degree of the microorganism's sensitivity to various drugs, because if it's showing signs of resistance, you need to know that. And then thirdly, the overall medical condition of the patient. If they have chronic problems, it can be more difficult to treat. Now, the last thing we want to talk about is minimum inhibitory concentration, MIC. And this is the smallest concentration of drug that can inhibit microbial growth. in vitro activity of the drug in the lab doesn't always correlate with what happens in the patient. So if the therapy fails, a different drug or combination of drugs or giving it a different way, administering it differently might be considered. But the best way to choose a drug with a high level of sensitivity but lowest level of toxicity we measure by what's called the therapeutic index. And this is the ratio of the dose of the drug that's toxic to humans as compared to its minimum effective drug or dose. So a high index number is desirable. And this is our last concept question. Which of the following TI drug value, therapeutic index value, might be chosen for a strep infection? Remember, the highest, 21.